Hey guys, it's Justine Buick from the NCLEXtutor.com, where I help nursing students pass the NCLEX and their nursing exams. So today I'm going to be showing you one of the best ways to learn and actually remember your meds, and specifically we're going to go over cardiac meds. So I want you to get a sheet of paper and start writing with me. We'll just write that at the top. I love to use colors, so I'm gonna make a little red heart here. Now, when I'm with my students and we're going over practice questions together or we're going over content, I am constantly asking them, what is that med for? And it's just a little prompt and it really gets them thinking about the content. And they'll say, well, what do you mean? What is this med for? What are you looking for? And I say, well, give me the classification or give me the condition. Why would we give this medication? And you can do both of these or just one of them. So I love using the letters of the alphabet as just prompts to help me get thinking about the content. So I'm going to write an A, B, D, an N, and a V. So these are the letters that are going to go with the classification. So A would be your antihypertensives. Well, what are antihypertensives for? What is that med for? Well, it's what it says in the wording. So it decreases the blood pressure, and a lot of them decrease the heart rate also. Now with B, we have our layman's term of blood thinners. Now what are those for? Well, they thin the blood. They prevent blood clots. And of course, this is for patients who have cardiac issues. So for an example, if someone has a dysrhythmia, it puts them more at risk for blood clots. D is your diuretics. And what are those meds for? Well, they help the patient pee. So if they have a lot of edema or they're in fluid volume overload. Now there's another D that goes under diuretics. It's not a diuretic, but it's a medication that starts with D, and you see it a lot, digoxin. Now what is that medication for? Well, that one just decreases the heart rate for people who have too fast of a heart. N would be nitroglycerin, or the nitrates. And these medications are vasodilators. So if the veins are dilating and they're getting bigger and bigger, it's helping to bring more oxygen to the area, hopefully. So that's going to decrease the blood pressure, but we mainly give these to help with chest pain. So patients who are having heart attacks, it'll help vasodilate, get those vessels open. And then the V is the vasopressors. So that's really the opposite of this. So vasopressors are the one medication that increases the blood pressure. So why would we want to increase blood pressure? So that would be for patients who are in shock, where their blood pressure is really low, and for patients who maybe are bleeding to death, okay, and then their vessels are too wide open. So that's why you would give a vasopressor. All right, so at the very least, this is what you need to know with cardiac meds, okay? Now, if you want, you can make some flashcards, but now we're going to get into just a little bit of detail of what are the actual different classifications under the antihypertensives and the blood thinners and the diuretics, and what are those names, because sometimes you get a question where it just says the patient is taking an antihypertensive, and sometimes you get the more specific name. So you definitely have to know those too. Now, a good way to remember the antihypertensives is just write out the letters A, B, C. So A would be your angiotensin receptor blockers and your ACE inhibitors. B would be your beta blockers. And then C is your calcium channel blockers. Now, what are the names of these? The angiotensin receptor blockers, they end in sartan. And then the ACE inhibitors end in pril. The beta blockers, I know you know this, they end in LOL. And then the calcium channel blockers end in dapine, like amlodipine. Now there's a couple or two random calcium channel blockers. There's diltiazem, and there is verapamil. So Zem and Mil. They don't all end in Zem or Mil, but it's just the ending of those two random calcium channel blockers. All right, so all those decrease the blood pressure and the heart rate. Now there's a couple different types of blood thinners. You know, blood thinner is kind of the generic name that we can say, but we have the antiplatelets. You have the anticoagulants. And you have the thrombolytics. So all three of these medications thin the blood, but just in different ways. So the antiplatelets are what? Aspirin. And then there's these medications that end in grel, like clopidogrel. There's a couple of them. Your anticoagulants are your heparins. So it could just say heparin. Sometimes it says enoxaparin. And I know that they end in parin. And then there's warfarin. Now, one more anticoagulant. A lot of people, for some reason, always forget these medications, but they end in aban. So apixaban, rivaroxaban. So definitely remember those. Now the thrombolytics are, they break up a blood clot. So of course they're going to thin the blood too. The thrombolytics end in A's. So tenecteplase, eltaplase. Now the diuretics, those are going to help make the patient pee. So it's people who are in fluid volume overload. Now there's two main types of diuretics. There is the potassium sparing. So that means that when the patient takes it, they just hold on to their potassium. So they keep their potassium. And a really easy way to remember that is it's called spironolactone. And how I remember it is I say the spiro is potassium sparing, right? So it's really easy. We'll start with SP. Then you have your potassium wasting diuretic. So that means that their body is getting rid of the potassium, and those are your furosemide, ide. So those end in ide. There's also another one called chlorothiazide. Oh, what is it called? There's also another one called hydrochlorothiazide. So it ends in ide again. Now digoxin is just by itself. The nitroglycerin is actually, I think it's an ingredient in dynamite. It like explodes, it vasodilates, it gets bigger. So it helps open up those vessels. And all of those have the word nitro or nitrate in them. Really easy to remember. And then the main vasopressors, so the ones that are going to help increase that blood pressure, those are epinephrine. And there's also norepinephrine, but it's just still epinephrine. That'd be like the EpiPens that you give for anaphylaxis, anaphylactic shock. And then there's also vasopressin, which is another term for antidiuretic hormone, ADH. Okay, so after you have gotten all the stuff in blue, you have that under control, then your next step is to make sure you know all the stuff in purple. Now let's see this in action, okay? So for an example, this question right here is a question that I would do with my students, and I'll give you a minute to answer the question and you can pause the video. All right, do you have your answer? So the nurse is administering a calcium channel blocker to the client diagnosed with a myocardial infarction. So which assessment data would cause the nurse to question administering this medication? So this question, the problem is that the patient has an MI and they are taking a calcium channel blocker. And then the last part of the question says, what data would cause you to question giving it? So there's something's wrong, right? Or maybe there's some kind of contraindication. But of course, if you're my student, what am I going to ask? I'm going to say, well, what's that med for? And you're going to go calcium channel blockers. Those were the antihypertensives, right? They decrease the blood pressure and they can probably affect that heart rate too. So let's go through them. The client's apical pulse is 64. Well, what's normal heart rate? Between 60 and 100. So it's a little bit on the low end, but it's still within normal limits. So if I do give this medication, it might drop it a little bit, but it's fine. It's within normal. So I'm not going to question that assessment data. The client's calcium level is elevated. Ooh, does calcium channel blockers affect the calcium level and make it go up even more? Maybe. I don't know. I would keep that one. The client's telemetry shows occasional PVCs. All right, so these are preventricular contractions. So is this going to make their PVCs worse? Does it, cause more of a dysrhythmia? I would say not typically. If you give a cardiac med, we're trying to help them with their cardiac issues. So it would be rare that it would actually cause more of a dysrhythmia. So, and if you know what PVCs are, they're just skipped heartbeats or they feel like heart palpitations. The client's blood pressure is 90/60. Ooh, that's kind of low. Okay, and remember, it is an antihypertensive. So what's normal blood pressure? 90/60 would be the low end, up to 120/80. So that's really low, 90/60. So if I give this medication, it's definitely going to drop it because this med is an antihypertensive. So when do you hold antihypertensives? Well, you hold it if it's less than 100/60, and it is definitely less than that. So even if I wasn't sure about number 2, number 4 is absolutely the answer because I know what this med is for. Now, you may be wondering, where am I getting all of this information for the different medications? Well, I'm just using my Nugget pages. So this is the book that I wrote that I use with all my students to go over medication. So it's a great way to review that content. And you don't just want to read it, you actually want to practice writing some of the content down or making your own flashcards. Well, I hope you found this helpful. If you want me to do this for endocrine meds or any of the other meds, just let me know. I'll probably do the videos anyway, just because I like teaching medications. But if you're interested in tutoring or the Nugget pages, there is the link below. Well, thank you so much for watching. Bye.